Is beauty objective or subjective? We all say beauty is in the eye of the beholder, but what if I told you that most of what we find beautiful can actually be measured down to the millimeter? A quick disclaimer before we dive in, this discussion focuses solely on physical facial beauty, not the warmth you feel for your beautiful grandma or the inner glow that a kind person has. I realize that this topic might make some people uncomfortable, so I'll keep it as respectful as I can whilst remaining factual. Most of us have heard the phrase, beauty is in the eye of the beholder. This popular phrase suggests beauty is purely subjective. In reality, it's both subjective and objective, but the evidence points to it being more objective than many of us like to admit. Take a look at the most beautiful lists that appear every year. The names might change, but the facial features are strikingly consistent. The women almost always have high arched cheeks, soft arched brows, plump lips, and a smooth tapered jawline. The men tend to have square chins, broad jawlines, and sharp angular contours. Cross-cultural research backs this up. People from very different backgrounds still rate those same proportions as the most attractive. That consistency suggests beauty isn't purely personal taste, it's at least partly hardwired. Consider the treatments that people actively seek out. Every year, millions undergo lip enhancement procedures. While lip reduction surgery is almost unheard of, that trend strongly suggests fuller lips are, on average, viewed as more beautiful. As a practitioner, I see this objectivity play out every day. If someone with a straight nose asked for me to add a big bump on their bridge or wanted their left cheek 3 times the size of their right one, I'd politely decline. Even if that's what they think is beautiful, it would throw their face out of balance. So rather than simply doing what's requested, I explain why it would undermine their facial harmony. The treatment we carry out should make someone look more balanced, address areas of concerns, and objectively make you look better. And why can I say this with such confidence? Because aesthetics training is grounded in measurable proportions, symmetry, sexual dimorphism, and golden ratio relationships. We teach these new principles to new injectors because when we hit them, most faces look better. When we violate them, most faces look worse. Yes, there are striking individuals who break the rules. A woman with a square jaw who is stunning, or a man whose nose bump becomes a signature feature. But those are exceptions, not evidence that beauty is purely personal. An exception does not break the rule. If beauty was purely subjective, I could just administer whatever a client asks for and trust that someone will like it. In practice, that ends badly. Overfilled lips, asymmetrical cheeks, and misplaced jaw filler rarely look good on anyone. Having treated more than 10,000 patients and mentored hundreds of fellow medical professionals, one conclusion stands out. Facial beauty leans more towards objective than subjective. The skill lies in applying those objective principles to each unique face, highlighting individual strengths rather than forcing everyone into the same mold. Yes, everyone has their own kind of beauty, but when we talk about aesthetic ideals, measurable proportions matter. The best treatments highlight a patient's strongest features, subtly downplay the less flattering ones, and leave them both visually harmonized and feeling like a more confident version of themselves.